you are testing that chemical in the lab to determine whether this causes harmful effect to the body, whether it causes damage to the liver cells, whether it causes damage to the skin, damage to the brain, and so on. Trying to determine the toxic effect of drugs, means pharmaceuticals essentially, because the company was developing medicines and was involved in conduct of the study, design of the study, analysis of the toxicity study data, interpretation, and making recommendation to the company whether the medicine under investigation can be taken forward for clinical testing in human subjects. After 10 years of my work in the laboratory environment, I moved to another company. Now it is called Pharmalex. Pharmalex is a consulting company. We work with pharmaceutical companies and we help them develop their medicines, cosmetics, and consumer products, where my role is to essentially look at the unwanted effect of pharmaceuticals, medicines, because any chemicals have both wanted effect or a desirable effect, and also they will have unwanted effect. So toxicology is a discipline of biology which deals with unwanted effect of a chemical. As I said, chemicals will have both wanted and unwanted effects. So if you go a little bit detail, what we do in toxicology is to understand or determine what adverse effects or harmful effects a chemical may produce to humans, animals, or to the environment. And then trying to understand how those adverse effects are produced. And then looking at what level of exposure or what dose those adverse effects appear and how we can mitigate those adverse effects. So the toxicology essentially deals with, the adverse effect of chemicals actually. To call somebody as a toxicologist, the person should have appropriate educational qualification on the one hand, and then on the other hand, they should have relevant experience. Now, if we talk about educational qualification, after completion of 12th standard, you are getting into a graduation program. Undergraduation. So the undergraduation, there are no specialized subject or specialized degree that that's dedicated for toxicology. So instead, students should opt for a relevant undergraduation program. I'm going to mention what are those relevant undergraduation programs. Once you complete those undergraduation degree, then you can select specialization master's program in toxicology or pharmacology, and that's how you pursue, and then maybe PhD, that's how you pursue your education. Now, I mentioned about relevant qualification, relevant undergraduate programs, which helps you to, become a toxicologist. So one is certainly veterinary science. In BBSc and AH program, that's Bachelor of Veterinary Science and Animal Husbandry, toxicology is extensively taught. And to my knowledge, there's no other course in India that deals with toxicology so extensively as veterinary science. So certainly BBSc and AH, is certainly an option. But again, there are not too many seats available, in India. As a country, we have limited number of veterinary colleges and limited number of seats. So, you should have a very good merit, then only, you will be able to get into veterinary medicine. Now the second option is actually to pursue undergraduation in B.Pharm, Bachelor of Pharmacy. Now, in Bachelor of Pharmacy, there is not much toxicology is taught, although it gives some kind of an orientation to pharmacology and toxicology. Remember, pharmacology is a very, very related discipline actually, or I should say that toxicology evolved from pharmacology, and therefore these two are very closely related discipline. So you can pursue B.Pharm, and then once you complete B.Pharm, you can opt for your master's program, that's M.Pharm, in pharmacology or toxicology. Some universities and colleges give M.Pharm specialization in pharmacology, whereas some other institutes gives M.Pharm specialization in toxicology. So that's how you can, get into, Masters of Pharmacy in toxicology. And the third option is actually the undergraduation, the MBBS degree actually. So in MBBS also you study pharmacology very extensively, but also toxicology, and especially clinical toxicology. Now again, you know the challenges of getting into an MBBS course. Also, once you are into 5.5 years or 6 years or whatever, you spent in a medical college, usually, students' inclination is to get into clinical subjects or, specialize in that area, not getting into a toxicology. So, but there are toxicologists who are human, MBBS graduates, human doctors. Now, these are the 3 undergraduate programs that you can pursue. And then once you complete your undergraduation, you opt for a specialization in toxicology or pharmacology. That's how you can, pursue your education in field of toxicology. Yeah, so to look for a career opportunities, I think if I summarize, the options available for a student who has completed masters in toxicology. One is certainly pharmaceutical industry, because a lot of requirement actually in the field of pharmaceutical development. And if you see the toxicologists who are working in India, most of them, majority of them are working in one or other way related to pharmaceutical development or drug development. So certainly pharmaceutical companies is an option that students should explore. Cosmetic companies, is another option. There are companies who are manufacturing chemicals. The chemicals could be for commercial use, in quintals, tons together. Companies manufacture certain chemicals for industrial use. So those companies also require. Or companies who are manufacturing consumer products. For example, we all use non-stick tawa, to make dosa, So even for companies who prepare, let's say who sell this kind of thing, prestige company, for example, they also require toxicologist help to see that, the coating that they make, to make it non-stick tawa, that also needs to undergo testing to see that, some residues of that coating are not left in the dosa that you prepare. And then finally the consumer, will consume that chemical. And therefore, it's important that, those things also evaluated. Or the household chemicals, or the toothpaste, for example, we are using toothpaste, and the ingredients that can be added into a toothpaste, what can be added at what level, these are all decided by the toxicologist. Bulk of the toxicologists, work in the private industry, actually, companies, pharmaceutical company, cosmetic company, and other companies which I already mentioned. Food industry, in food industry also, toxicologists are required, because in the packed food especially, and food processing, actually, there are different additives and chemicals are used. Now it's important that when we add chemicals to the food, it may be for the purpose of preservation, or as an antioxidant, or for any reason. One needs to ensure that those chemicals don't harm the people who are consuming that food, and therefore they also, students can try, options there in those food companies also. How do you actually evaluate a chemical when you don't have the data? For everything, you can't perform experiment, use animals, and because that's ethically it's not correct, but also it is resource intensive. For example, there is a chemical which you want to use for some purpose, and you want to know whether this chemical causes cancer if somebody is getting exposed every day. Now, to understand that, you will have to perform a lifetime carcinogenicity study, in rats or mice typically, which means, 2 years of administration of that compound to the rat or mice, and then maybe another 6 months of additional laboratory investigation. So 2.5 years. Now, maybe additional few months of preparation for that. So roughly 3 years actually, and a lot of money. Now, you can't conduct studies because cancer studies require large number of animals, ethically, which is not correct. And it's also time consuming and resource intensive. Economically also, it's very difficult. So that's a big challenge. Now, without performing a cancer study, how will you still decide whether this chemical is going to be harmful or going to be carcinogenic or not, without testing? Now, this is just cancer is just an example, but for any other type of harmful effect, whether the question on whether it causes liver toxicity, whether it causes kidney damage or a pancreas or brain or anything. Now, without doing experiment, how will you judge that chemical? This is the biggest challenge, because practically it's not possible to evaluate every chemical and test them again and again. And therefore you will have to have a better understanding of chemistry, and this is one of the essential skill that any toxicologist should possess, actually, ideally. And today, but many of the toxicologists don't have an understanding of the chemistry, but that's a big gap, actually. So chemistry understanding is required, because looking at the structure, chemical structure, you will be able to predict reasonably, whether this is going to be toxic or not. So that kind of knowledge is required, and today that's a gap, actually. So ideal toxicologist should be expert in chemistry and expert in biology, which is most of the time that's not the case.